Peritonitis is the inflammation of the peritoneum, typically caused by infection or chemical irritation. It is categorized as spontaneous bacterial peritonitis, secondary peritonitis, or tertiary peritonitis based on the underlying cause. Spontaneous bacterial peritonitis, or SBP, is a primary infection of the peritoneal cavity without an apparent intra-abdominal source, most commonly seen in patients with cirrhosis and ascites. Symptoms include fever, chills, diffuse abdominal pain and tenderness, altered mental status, nausea, vomiting, diarrhea, or ileus. Diagnosis involves paracentesis, where polymorphonuclear leukocytes count is greater than or equal to 250 cells per microliter in acidic fluid, positive acidic fluid culture, and serum acidic albumin gradient greater than 1.1 grams per deciliter. Laboratory tests include CBC, liver function tests, and blood cultures if systemic infection is suspected. Treatment includes antibiotics like third-generation cephalosporins, adjunctive therapy with intravenous albumin, and prophylaxis with norfloxacin or ciprofloxacin for high-risk patients. Peritoneal dialysis-associated peritonitis is an infection of the peritoneal cavity in patients undergoing peritoneal dialysis. Symptoms include abdominal pain, tenderness, cloudy dialysis effluent, fever, and malaise. Diagnosis involves dialysate analysis with PMN count greater than 100 cells per microliter and positive culture, and clinical criteria of symptoms combined with evidence of infection in dialysis effluent. Treatment includes intraperitoneal antibiotics like vancomycin and ceftazidime, and temporary suspension of PD if refractory. Tuberculous peritonitis involves peritoneal infection by Mycobacterium tuberculosis, often associated with extrapulmonary TB. Symptoms include chronic abdominal pain distension, fever, night sweats, weight loss, and ascites. Diagnosis involves acidic fluid analysis, culture and biopsy, and imaging like CT. Treatment includes anti-tubercular therapy with a 4-drug regimen and adjunctive therapy with steroids for severe peritoneal inflammation. Secondary peritonitis results from perforation, inflammation, or trauma to intra-abdominal organs. Common etiologies include gastrointestinal perforations, trauma, post-surgical complications, and infections. Management involves diagnosis through clinical examination and imaging, conservative treatment with IV fluids and antibiotics, and intervention with percutaneous drainage or surgery. Generalized secondary peritonitis management includes initial stabilization, surgical intervention, and postoperative care. Note: the prognosis of peritonitis depends on early recognition, prompt intervention, and the patient's overall health. Thanks for watching. Like, share, and subscribe for more interesting and informative videos.